Skull base surgery is a very niche subspecialty of neurosurgery. It involves surgery of the area of skull base. Skull base, as in this area of the skull. This is called as skull base. This area of the skull houses very delicate structures like the most of the cranial nerves, the pituitary gland, the major blood vessels of the brain are all come within the ambit of skull base zone. So any surgeries involving skull base is a very skilled procedure that requires years of training and expertise. Skull base surgery, as I already said, is a very intricate surgical procedure wherein we make use of several techniques like minimally invasive technique, endoscopic technique, and also we make use of high-end microscope in the removal of while handling the pathologies involving skull base zone. The difficulty of skull base surgery is related to the accessibility of the zone. As I already said, the skull base zone is in this zone, and reaching to the skull base is very difficult given the proximity of other very important structures. Say for example, any tumors or pathologies involving the surface of the brain, it is very obvious. We can access it easily from the surface. But since the skull base zone is hidden here among the very crucial important structures, the accessibility is a challenge. So this challenge can be overcome with the help of minimally invasive techniques, endoscopic techniques. Apart from the accessibility, there are other challenges like the size of the tumor. If the tumor is of very significantly large size, once the tumor is excised, bringing the tumor out of the skull base is also a challenge. So all in all, skull base surgery is a challenging procedure. But nothing to worry. With the help of adequate gadgets and an expert neurosurgeon, you are in safe hands to undergo skull base surgeries at our center. The duration of hospital stay with respect to skull base surgeries may be slightly prolonged by a few days. Given the complexity of the procedure, patient needs to be monitored very closely in the post-operative period compared to the other surface tumors. Say for example, a meningioma of the brain surface, a pituitary tumor that was excised by endoscopic technique through the transnasal technique. They will definitely require close observation and monitoring in the ICU in the post-operative period for a few days more. Skull base surgery is an emerging field of subspecialty in neurosurgery, especially over the past decade or so. With the advances in diagnostic procedures, the surgical procedures, and the advanced microscopes that are available today, previously inaccessible and untreatable tumors are now amenable to treatment. Complete removal of the tumor is now possible with the help of the advanced techniques and the gadgets available with us. The future of skull base surgery is very bright, and near total recovery of patients with skull base tumors is possible in the near future.